So basically, there are two major indications for a liver transplant to happen. So one is acute liver failure, and in that again you have subdivision called as acute and chronic liver failure. Liver diseases can be classified into alcoholic liver disease, then autoimmune liver disease, and familial liver diseases, and non-alcoholic steatohepatitis. You have to avoid all toxic stimulation for the liver, like drinking, smoking, and having fried food, so fatty foods, and especially canned foods. So basically, you have to avoid calories, you have to lose weight, and maintain good protein intake, because when fatty liver means that the synthesis of protein is not happening properly.
Hi, Dr. Webber. It's so amazing to have you with me at the studio today. So, Doctor, you are consultant liver transplant anesthesia and liver ICU at Meot Hospital. I want to start with asking you, as an anesthesiologist, why did you choose liver transplant as a specialty, and what is organ transplant and liver transplant actually?
Good morning, Rashmi. Glad to be here. Thank you for the opportunity, and I thank your team members for this very nice arrangement. To begin with, after I finished my anesthesia PG degree, I had my own group of anesthesia with 7 8 people working in that group. And I was doing all the routine cases, general cases, as well as orthopedic cases. So after a period of time, people started joining our team, and then the work became kind of monotonous. So I was getting bored with the kind of work which we were doing, and it was like not a proper perioperative and intraoperative and a post-operative care. So I wanted to be into a role which is more kind of a physician kind of a role. So in liver transplant anesthesia, we start assessing the patient right from the day when we see them. So we have to stabilize the patient, we have to intraoperatively also manage the patient, and even in the ICU we have an opportunity to make them go out of the ICU safely. So it gives kind of a complete physician kind of a feeling, although the degree is anesthesiologist. But yeah, this is the reason I chose liver transplant.
And how does it work, doctor? I mean, organ transplant has always been something of an interesting topic for anybody, and it's also a very vital and crucial aspect of recovery for people who really need this. So, how does it work, liver transplant and organ transplant? What is it? How does it happen? When does it happen to a patient?
Yeah, so basically there are two indications, major indications for a liver transplant to happen. So one is acute liver failure, and in that again you have subdivision called as acute and chronic liver failure, uh, and then we have a chronic liver failure. So chronic liver failure and acute and chronic liver failure, these are the conditions where the patient liver is already decompensated in the sense the liver cannot tolerate any shortest interval of insult in the kind of a low blood pressure or a low oxygen or any source of infection anywhere. So whenever these triggers are there, it affects the liver very fast and it starts to decompensate. Decompensation can happen in the form of flare up of the infection going into the body, which is called as a systemic infection or sepsis. Then another thing which can happen in a liver patient is he can become confused, which is called as hepatic encephalopathy. So there are different grades of hepatic encephalopathy, starting from grade 0 to grade 4. So, and another thing which can happen is bleeding, which is most common in a liver patient when platelets are low, which is called as a thrombocytopenia. So any insult in a chronic liver patient or a decompensated patient, they will not tolerate this and they will progress to further liver failure very fast.
Doctor, the liver is the only organ in the body which can actually regenerate, right? So, when does a liver actually? And now I had spoken to multiple doctors who say that the number of fatty liver, grade 1 fatty liver, even the non-alcoholic fatty liver syndrome is actually increasing. So, when when does the liver give up, and what does the liver actually do?
See, liver has got a lot of functions to carry out. It is the biggest organ in the body, and the functions of the liver can be divided into synthetic functions, metabolic functions, and there are other miscellaneous like digestive system. It produces the bile, and then another thing is filtration of the toxins. So these four major functions liver does. So in that metabolic, it is whatever you eat. So it has to form glucose, it has to then digest the food with the help of the bile, and then it will secrete the bile, and then further the digestion of the food happens and food is getting excreted. So then coming to synthetic function, the most important synthetic function what liver does is about the coagulation factors. Coagulation factors are the factors which are important for arresting the bleeding. So factor 8, and there are many other factors which it is not people can't understand in the public domain, but whatever is needed for arresting a bleeding, it is formed by the liver. So whenever this insults happens, if you see when we do the lab reports, these values go down. So what we see in the lab values is platelets, we see the INR. So whenever there is a liver insult, so these values go up in a chronic liver failure patients when there is any insult to the liver. So our target at that time is to correct the coagulopathy if patient is bleeding. Otherwise, we have to give supportive care, treat the infection, and get the values back to the normal.
So, would you say that the lifestyle, choices that people are making, like excessive food, obesity, are contributing to liver failure as well? Is there a rise, or there's no such
Yeah, so
correlation?
basically, liver diseases can be classified into alcoholic liver disease, then autoimmune liver disease, and familial liver diseases, and then you have got what you said is non-alcoholic steatohepatitis, NASH. Okay, so alcoholic liver disease, as you know, when you consume alcohol for longer duration of time and above the limits which is being stated in the books or by the experts, even that different person's liver acts differently, so you don't know what is exactly a correct value for alcohol consumption. So anybody who is taking alcohol for over a period of time, they get prone for alcoholic liver disease. And second thing is when they start smoking, so it aggravates the liver disease. Autoimmune, nobody has control over it because it is something which, because of the autoantibodies which are formed in the body, it goes and attacks the liver cells. It doesn't accept the liver as its own organ, and it targets the liver cells, so liver gets affected in that. Coming to familial, there are conditions where the liver disease is seen in families.
So liver disease is
Yes,
hereditary as well.
it can't be said as hereditary, but yeah, there are conditions like familial amyloidosis and something called as progressive familial intrahepatic cholestasis. So these are few conditions where you can say that it runs in the family. So what happens is amyloid is nothing but its form of how our body deposits fat. So amyloid is form of a deposition, so it goes and deposits into the liver. So liver finds it difficult to filter that amyloid, and it affects the synthesis and functioning of the liver, and it becomes fibrosed. Like how when the iron goes and gets deposited in the liver becomes stiff. So basically when the liver becomes stiff, the functions of the liver get affected. Yes. And coming to NASH, yes, now as you said, there is a rise in the incidence of non-alcoholic steatohepatitis. So how this happens is, one is because of the lifestyle changes which we have got into ourselves by eating a lot of junk foods and fried foods, and not keeping ourselves healthy, not doing routine exercises. And another risk factor for NASH related disease is long standing diabetes and long standing hypertension. So those who are dependent on insulin, or those who have uncontrolled hypertension. So because of the vessel wall modification, the flow in the liver also gets affected, and they are more prone for NASH related decompensated liver disease, chronic liver disease.
When a user or a customer, or I mean, sorry, a person is diagnosed with liver 1 or liver grade 1 or grade 2 fatty liver, is it possible for that person to reverse it?
Yes, so grade 1, grade 2 till grade 3. These are the grades where, with the lifestyle modification and weight loss and strict diet control, uh, you have a chance that the further progress of the liver disease doesn't happen, and in some patients it also the liver regenerates and starts doing the function
How
normally.
long does it take for the
So it all
regeneration?
depends on how quickly you adapt to the instructions given to you, how quickly you do the weight gain, and you have to avoid all toxic stimulation for the liver, like drinking, smoking, and whatever is not good for liver. So having fried food, so fatty foods, and especially canned foods, which they contain a lot of. So basically you have to avoid calories, you have to lose weight and maintain good protein intake, because when fatty liver means that the synthesis of protein is not happening properly. The most important protein is albumin for us. So for a person to maintain a good healthy lifestyle, you need to have protein. So in liver patients the synthesis of protein is less, so you have to have a higher protein intake, say like routinely requirement of protein is 1.5 grams, so you can increase it to 1.5 to 2 grams per kg per day. So, and protein in the sense, you should have egg white, you should not have the yolk. Then you can have soya, chicken. So again, this comes as a typed format which is given by the nutritionist, dietitian, whenever a liver failure patient comes to us.
Typically, what is the time duration? How many months can a person recover? And from being a fatty liver patient of grade 1 or grade 2, what is the time frame it takes until when the liver actually gives up and you have to, then seek transplant? Like, or is it like there's no.
See, if it is grade 4 fatty liver and there is fibrosis which has started, that means the liver is not going to regenerate. Once the fibrosis starts, liver is not going to
Which is
regenerate.
thickening of the
Yes, fibrosis is
tissues?
nothing but thickening of the liver tissue. Okay, so once it is grade 4 fatty liver, you should be having a regular follow up with your specialist consultant, like a hepatologist or a gastroenterologist or a surgeon. Ideally, people should go to a hepatologist or a gastroenterologist who is attached with the hospital, because they can manage still on medications for a period of time and stabilize the patient. If these specialists are not available, then you can also visit a experienced surgeon, because who has been working for over a period of years, so they also can guide you very well. So it is difficult to say in how much period the liver regeneration will happen when it is a fatty liver. Uh, okay, because it all depends on your lifestyle modification. But you can say generally when we do a living donor liver transplant, when we take it from a donor and we cut the liver, there is the right lobe and the left lobe. So for adults, usually the right side of the liver is put. So the regeneration of the liver happens over a period of 6 to 8 months, maximum 10 months. So that is for the donor. But when the patient is having a fatty liver, we cannot say when it is going to get back to the normal. You have to go get frequently evaluated, do a fibro scan, what is your stage of fatty liver, whether it is regressing or not. Ideally, regular follow up is what is more required.
A normal person like me, what are the signs and symptoms I should look at to see that, okay, now I need to check if my liver is healthy or not?
Yeah. So generally, after 40 years, it is always advisable to get a ultrasound screening done, whether you have anything or not. But the most common symptoms what common public can come across is getting easily fatigued, getting tired, not able to do their work, routine work. Even if they they climb stairs of 2 flight stairs, they will say, oh god, I am tired, I can't manage this. Then Another thing which they can come across is, whenever they walk for a distance or they keep the legs down, they will have a lot of edema in the legs. Yes, and they will have bloating. They will have a sensation of full stomach. They can't have the normal diet. Their intake goes down. Okay, so and sometimes in some patients, if the platelet counts and the coagulopathy is affected, whenever they do the brushing or whenever they try to pick the hair from the nose and all, it will have a lengthened time of bleeding. To arrest the bleeding, it will take a lot of time. So these are the common signs and symptoms. Other symptoms which you come across when the disease has progressed is collection of water in the stomach, which is called as ascites. It is nothing but because your albumin is low, so whatever extra fluid is there, it is not being not being gathered into the central compartment, and it is getting out into the third space, so around the stomach, abdomen. So there is collection of water which is called as ascites. Then they have electrolyte imbalances, like they can have low sodium, they can have low potassium. So when they have low sodium, they have confusion, and they may have encephalopathy, as I said, which is called as hepatic encephalopathy. So these are the signs and symptoms which they come across when it is progressed a bit. But in the early stages, fatigue, tiredness, unable to do routine work, and leg swelling.
So I know that for kidney transplant, for the heart transplant, there is a centralized list where you have to register yourself as a person needing a donor. Is that also applicable for liver transplant?
Yes, yes. So in Tamil Nadu, everything is done by the state government under the leadership of CM Stalin sir. So the organization is called as Transplant. So for cadavers also, like when they are in need for organ, so the recipients, they get listed in the whatever hospitals they go and choose whatever. So according to the waiting list, they are listed in different hospitals and zone wise, and it is a very transparent process, and they are alerted when there is a chance for an organ by the respective hospitals. And so it is also based on waiting list, so you cannot jump it, like whatever the situation is. Only in cases, special cases, where there is an acute liver failure patient who needs a big liver, so at that time Transplant has some relaxation and special considerations, where the waiting list they can jump, and they give the preference to the acute liver failure organ. So it is all as per the waiting list, whatever the Transplant decides, and the hospital authorities are all in coordination with Transplant.
You said there were two types of donation, right? One was the cadaver donation and the live donor. For both, you have to be registered in Transplant.
No, 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 no. For live donation, you need not get registered in Transplant, because Transplant is a authority which only takes care of cadaver organ donation. So that is because you needed an impetus for the people to push for organ donation. So the state of Tamil Nadu, in 2008 they came up with Roto, and then in 2014 I believe that was changed to Transplant. So till now, as per my knowledge, in Tamil Nadu, somewhere around 2,000 liver transplants have been done, and kidney transplants is more than 3,700. So, and consecutively for 3 years, Transplant was awarded with the best organization for having conducting the organ donation in a very fair way. And the state of Tamil Nadu is the only state where they are actually giving honors, state honors, when organ donation is done.
Doctor, so this trend that you're observing, that a liver transplant being needed only by alcoholics, you're saying that even lifestyle is now impacting. There is a shift in the kind of patients you're seeing, where lifestyle choices are also leading, not just alcohol or cigarette consumption. Even the eating habits and sedentary lifestyle are contributing to requirement of liver transplant.
Yes, yes, definitely. whatever the dietary habits we are having now, unhealthy habits, everything liver has to bear it, right? Whether it is alcohol or food, whatever you consume, the metabolism is going to happen by the liver only. So any toxin which is going into the body is going to be metabolized by the liver. So all the dietary modifications which we are, unfortunately, just accepting it, yeah, liver is getting a hit by that.
Such an interesting conversation, Doctor. In the next episode, I would really like to cover more details about liver transplant, and I'll see you in the next episode
Sure.
then.
Thank you so much. Thank you, Rashmi.
Thank you.